Hello, everyone, and welcome to today's session, Managing CKD Complications Through Nutrition and Medicines. My name is Ryan Woolley, and I'm the Senior Director here at the American Kidney Fund and a registered dietitian, Senior Director of Public Education. Today's session will review 4 common complications of CKD that can be managed by changing what you eat and taking certain medicines. Those include gout, anemia, hyperphosphatemia, which is high phosphorus, and hyperkalemia, which is high potassium. Let me pull up the slide here. Just want to say a thank you to our sponsor, Ardelyx, for sponsorship of this session. And next, I'd like to introduce our 2 panelists for today. We have Aurelie Gutierrez and Dr. Blake Schusterman. Aurelie is a registered and licensed dietitian and board-certified renal nutrition specialist who has experience in a variety of settings. She currently works as a renal dietitian for DaVita Kidney Care and owns Latina Kidney Dietitian, LLC. She is committed to practicing with cultural humility and improving cultural competency in the nutrition space. And I'd also like to introduce Dr. Blake Schusterman, who is a nephrologist in Greenville, South Carolina, where he cares for patients with CKD in a variety of settings. When not practicing nephrology, Dr. Schusterman educates people about kidney-friendly eating on his platform known as the Cooking Doc. He has created recipes and YouTube videos to help people apply practical strategies for small lifestyle changes. Thank you to both of our speakers for being here today. So to get us started, I'm going to pass it to our video of Dr. Schusterman, who will share information on gout and anemia.
Hey, everybody. Thank you so much for joining us today. This is the American Kidney Fund's Kidney Action Week, and I am so glad that you are all here to watch. This is one of my favorite events of the year, and I've participated in different lectures throughout the last probably 5 to 7 years in this event, and it's just perfect because this is information made just for all of you out there with kidney disease and your family members with kidney disease. It is information that you can use to try to better your health. And I'm always so impressed with everybody who comes and watch because everybody who comes and watches this wants to do better for their health. You are taking control of your kidney disease. You are looking to get the information you need to feel better and to get better treatment. And so it's an honor to be here to talk to you all today. My name is Dr. Blake Schusterman. I'm a nephrologist and I practice in Greenville, South Carolina. And you can see that I also am talking to you from my kitchen. You're probably like, why is this nephrologist talking to me from my kitchen? This doesn't make any sense, but it does. I'm also known as the Cooking Doc, so I believe in food and what you eat as a very important way for people to help manage their kidney disease. So I always talk from my kitchen. Thank you for joining. Thank you for watching. I'm talking about something today that I haven't talked about before, and we're going kind of old school. So I've got my little whiteboard here to remind me what we're talking about and to keep you on track. We are going to be talking about anemia, and we're going to be talking about gout, and we're going to be going through what are each of these things, why kidney disease causes them, and then what helps. So how does this relate directly to you or your family member? Are there medications that help? Are there foods that help? And how can you take this information and go to your doctor and say, okay, this is what I learned. How can we apply this to my care? And I'm not your doctor, so this is all generic advice. So let's get going. First, we're going to talk about anemia. So what is anemia? You've probably heard of it, but you may not know what it is. So anemia is when somebody has a low red blood cell count. You can see it as a low hemoglobin or a low hematocrit on your blood tests. And anemia has a lot of symptoms for people with kidney disease. A lot of people notice that they are fatigued or tired. And anemia is when those levels, that hemoglobin or hematocrit or red blood cell count, get below normal. And that can make you feel tired because these red blood cells are the deliverers of oxygen to your tissues. So everything in your body needs oxygen or else it can't function. So if you're not getting oxygen to your tissues because you're anemic, then you can feel bad. It's very common in people who have kidney disease just to feel tired all the time, just feel sluggish. There are a lot of reasons that people can feel tired with kidney disease, but anemia is certainly one of them. So when you think about anemia, anemia is a problem in the blood, and you're probably wondering how that has to do with the kidneys. So it is important to understand that the kidneys, okay, they're the best organ. I mean, and the most complicated organ, and everybody needs to acknowledge the fact that the kidneys aren't just there to filter out the toxins in your body and get rid of the urine. Your kidneys do a lot of different things like control hormones and control blood pressure. And the way they control the hormones actually is why people with kidney disease develop anemia. So anemia, you think about low blood count, but where do those blood cells come from? They come from the bone marrow, okay? But the bone marrow has to be told to make those blood cells. And the way it's told is through a signal from the kidneys. The kidneys release a hormone called erythropoietin. And erythropoietin goes to those bone marrow cells and says, make red blood cells. Bone marrow makes them. Those red blood cells go through the body. They carry oxygen to the tissues, just like it's meant to be. But if you have kidney disease, that process gets messed up. So the signal from the kidneys for that erythropoietin just isn't there as strongly as it is in people with normal kidneys. So the bone marrow doesn't know to make the same amount of red blood cells. And so it makes fewer red blood cells. And that leads to the anemia. Now, that's one of the main reasons that people have anemia with chronic kidney disease, but it's not the only one. The whole system is set up on everything working right in the body, and chronic kidney disease can lead to this chronic inflammation. And chronic inflammation can impair the blood system that leads to normal red blood count, hemoglobin, and hematocrit. Also, iron is important in these red blood cells carrying oxygen to the tissues. And people with kidney disease can have difficulty with iron absorption or the way those blood cells kind of handle the iron. All those things put people with kidney disease at risk for anemia. And so how common is it? So, if you look at early kidney disease, stage 3, you may see somewhere between estimates 8 and 15%, but then stage 4, almost half of the people are estimated to be anemic. Stage 5 can be up to 60% or higher. And on dialysis, between 80 and 90% by some estimates of people on dialysis have anemia. So it's very common and something that you should know about if you have kidney disease and be asking your doctor about. All right, so we know that kidney disease causes anemia. We know that anemia can make people feel bad. So what helps? What can we do to make sure that anemia is managed and that you feel better? So the first thing is to make sure that there's nothing else going on. Okay, we think the kidneys are causing the anemia, but maybe there's something else. Maybe somebody is bleeding that we don't know about. Maybe there's nutrients like B12 or folate or the iron that are low that need to be replaced. So we make sure that the body has all of the ingredients to make red blood cells and that the body is not actively losing red blood cells. So that's kind of where we start. We give the body a chance to get some testing done. You may have your B12 or your folate levels tested. You may have your stool tested to make sure you're not losing blood in your stool. And so we kind of start there to see what's causing the anemia. And if all those things come out okay, then we kind of default to, okay, kidneys are the problem. So the chronic kidney disease, if that is the problem with the low blood count, then we look to, is it going to help to replace that hormone, that erythropoietin, to make sure that the bone marrow makes more blood cells? So there are a number of different preparations where we can say as doctors, okay, in order to make somebody's blood count better and make them feel better, we will start with an injection to help boost that blood count up a little bit. Now, the important thing to note is that we don't want that blood count to get all the way up to normal in people with kidney disease with these shots, because that can cause other problems. So your doctor can kind of look through your labs and say, okay, what is the best estimate of what my hemoglobin should be for my stage of kidney disease? What's a good dose of medicine that may keep that hemoglobin up without causing too many side effects? Because all these medicines have side effects. These are all individual discussions to have with your doctor. There are also some new pills that people are taking that can stimulate the production of this erythropoietin in the kidneys and lead to better blood count and tell that bone marrow, you need to make blood cells. And so a lot of different ways that it can be done. People with kidney disease also may need extra iron. So would you benefit from an iron pill? Would you benefit from intravenous iron, because people with kidney disease don't always absorb iron in their gut the same way that people without kidney disease do. So there are a lot of medications that can be given if the situation is right to help boost that blood count and help you feel a little bit better. Now, the one thing that I always get from my patients, and you're probably thinking this yourself, is, okay, this guy's the cooking doc. Why doesn't he tell me what kind of foods I need to eat to boost up that red blood cell count, boost up that hemoglobin, boost up that hematocrit? What can I eat? And unfortunately, there is not a lot that you can actually eat or do on your own, because most of the time, the problem is the signal. It's that erythropoietin that is not available, that's not signaling the production of those blood cells. So if you don't have that signal, it doesn't matter what you eat. Every now and again, I'll have somebody come in and they'll say, okay, you told me I was anemic. I've been eating liver every day for the last month, and my hemoglobin is not any better. So liver is not the answer, okay? It doesn't matter how much extra iron you get. If your body is not set up to produce those red blood cells, then it just doesn't matter. And that, I think, is one of the most important myths that we need to kind of bust here going forward, is eating doesn't fix your hemoglobin in people with kidney disease. So look towards other things. Of course, if you're deficient in B12 or folate, making sure those things are replaced is important. And so you could take this information and go to your doctor and say, okay, doc, I'm anemic. Is it from my kidney disease? What do you think? Is there anything else we can do about it? Are there medicines? Am I a candidate for these medicines? Will they help me feel better? If you're on dialysis, this is probably happening automatically in the background. Your doctors are watching that every day. And it's really important to have that conversation with your doctor to say, what is going to make me feel better? And that is really the most important thing with all of these things that we talk about. And as a nephrologist, I want my patients to feel better. I want them to stay out of the hospital. I want them to have energy. I want them to have time to spend with their family and enjoy their quality of life. And so sometimes managing anemia is one of the ways that we can help this. Again, none of this is medical advice. It's just information that you can take to your doctor and see how it can maybe apply to you. Okay, so that's anemia. And now we're going to shift gears a little bit, and we're going to talk about gout. So now we're over here. We're going to talk about gout. So what is gout? Why does chronic kidney disease cause it? And then what helps? Medications, foods, and how can you take this information to your doctor? Okay, so what is gout? Gout is a buildup of uric acid and uric acid crystals that form in your joint. So, you think about your thumb. Imagine if you had crystals that were depositing in one of these joints. Now, those crystals deposit and then they cause inflammation. And then that joint will get hot and red and really painful. So sometimes people wake up in the morning with gout, and if they have an inflammation in their foot, they can't walk because the pain is so bad. And it gets really common in people who have kidney disease. So kidneys do a lot of other things other than just filter the waste products. They also help the body get rid of things like uric acid. And that uric acid is what causes gout. It gets deposited as crystals in those tissues. So when the kidneys aren't working right, when you have chronic kidney disease or your family member has chronic kidney disease, just think that, if your uric acid level is normally around 6 based on what you're producing, and then the kidneys stop filtering out, that level can just go up and up and up to a point where it starts crystallizing and causing these symptoms and pain. And there are other things that cause gout in people with kidney disease. So a lot of people with kidney disease have to take diuretics. Diuretics are the pills that make you pee. And sometimes they also make your kidneys hold on to more uric acid. So it sounds counterintuitive or it sounds wrong. Why would we give somebody that can't get rid of uric acid a medicine that would make them hold on to more? And that's kind of one of the things that we always have to deal with kidney disease and with medications. Benefit, risk, how is this going to help you and improve your situation and how you feel in the long run? By some estimates, between 20 and 25% of people with stage 3 kidney disease have it. And if we want to review the stages of chronic kidney disease quickly, they're based on your filtration rate. So 30 to 60 is stage 3 chronic kidney disease. 15 to 30 is stage 4 kidney disease, and less than 15 is stage 5 kidney disease. But 20 to 25% of people, by some estimates, have gout at stage 3. And every stage you go down, that risk goes up because of medicines and also because your kidneys can't get rid of the gout. So how are we as kidney doctors going to help you not be so miserable when you have to deal with all these gout flares? So how do we treat gout? So I think we break it into 2 categories, okay? And this most important thing to remember. So category 1, medications and interventions to keep that uric acid from building up so it doesn't cause gout. And number 2, if you get a breakthrough in gout symptoms, how do we calm down that inflammation in the joint so that you can feel better? Okay, so first we'll talk about prevention. Okay, so getting your uric acid level down to a level that doesn't lead to gout attacks is the best way to treat it. And we're going to start with medicine. So there are a couple different medicines that your doctor may talk to you about. So things like allopurinol, things like Uloric. There's a medicine called Krystexxa, which is an infusion. And there is a medicine called colchicine, which some people take both to prevent gout and to treat gout. And one of the things that I always think about as a kidney doctor is we know best how to assess which of these medicines is going to be right for you, because sometimes it's a difficult decision. Some of these medicines are cleared by the kidneys, so you can't use higher doses. Some of these medicines can paradoxically put you at risk for other things related to the kidneys. So having a good doctor that you can talk to say, okay, what's my plan? How are we going to prevent this gout from happening? Are there medicines that I can take? I mentioned those medicines just as information purposes. Not everybody is a candidate for all of them, and there are pros and cons with each of those medicines. But the way they work is essentially by lowering the uric acid levels in the blood and allowing the risk that those crystals build up to go down. Okay, but we're not always great at preventing the gout from happening. So there is a second treatment layer where we can actually take the acute gout flares. So if that toe is hot and red and painful, and how are we going to treat it? There are also medicines that treat that. So there's a medicine called colchicine that sometimes people take. There is a medicine called prednisone, which is a steroid that sometimes people take. And all of these medicines have potential side effects. So if somebody has diabetes, prednisone or steroids can raise up the sugar. If somebody already has significant kidney disease, the colchicine dosing has to be adjusted, and we have to make sure that it's safe for you. So um, we like to prevent gout. That's better. And if we have to treat it acutely, that's worse for everybody. So we like to really focus on the prevention. And the good news is that we can often get gout under control. There are medicines to help. And unlike anemia, there are some foods that may be able to help with keeping that uric acid from building up. So let's talk about some of the main things that diet sometimes can be used to help prevent that gout. And here I am in the kitchen. So um, if you can change your diet in a way to help prevent your gout, that's the first step. Now, diet may lower your uric acid a little bit, but it's not going to be as effective as the medication. So um, things that cause a lot of gout attacks. So I don't know how many of you out there eat liver or kidneys, but don't eat them anymore. They're not good for you. They can trigger gout. Just get rid of them altogether. Diets that are really high in animal proteins, so especially red meats. So purines in these meats are broken down, and that can cause uric acid to build up in the body. So limiting meats and red meat intake is important. Shellfish sometimes triggers gouts in people because of those purines. Alcohol consumption can trigger gout. And then there's also data that things like sugar sweetened beverages and highly processed diets can lead to gout attacks. So, those are the things that can cause problems, but it's more fun to talk about the things that may help. So, what should you do for an eating pattern? And of course, talk to your doctor or dietitian, but things like the Mediterranean diet may help. Things like the DASH diet, the dietary approach to stop hypertension, have been shown to lower the risk of gout attacks. And they're also good diets for kind of everything else. They may lower your risk of high blood pressure. They may lower your risk of kidney disease progression. I think it's important to mention that a lot of people talk about cherry juice as kind of a treatment for gout, but most doctors don't see that as the way to go. I think the most important thing is to focus on limiting animal proteins, limiting sugar sweetened beverages, limiting alcohol, and talking to your doctor about what medications you can use to prevent gout. So you can go to your doctor and you can say, okay, are there any medicines that I'm on that are leading to my gout? Are there any medicines that I can take that will help me prevent gout? If I have a gout flare, what medicines can I take? And what foods do you recommend maybe that I check out as a way to help lower my risk of getting these gout flares? I'm sorry I'm not available at the time this lecture is going live. I'd love to answer your questions about gout and kidney disease. I'm so glad you're here, staying an advocate for yourself and your family member, empowering yourself with the information that you have to treat your kidney disease. That's what I'm all about. That's what I love to see. If you need more information about diet and kidney health, I'm available on my website, cookingdoc.com. I also have a YouTube channel, lots of good information about kidney disease and health that you can find out more there. Your doctors and your dietitians, of course, are your best resource. I hope you learn a lot this week. I'm so glad you're here. Thank you to the American Kidney Fund for inviting me. I think we covered everything on my list, and I hope you enjoy the rest of your week.
All right. Thank you to Dr. Schusterman for that great presentation on gout and anemia. And just a reminder, our next session is a Q&A with two renal dietitians. So if you have any questions that have come up throughout this session, hold onto them and bring them to our Q&A session, and that's starting at 1 p.m. Eastern right after this. All right, and now I'll pass it over to Aurelie to discuss potassium and phosphorus.
Wonderful. Thank you guys so much for having me. Again, I'm Arely Gutierrez, a Latina kidney dietitian, and there's nothing that I love more than talking about kidney nutrition, and I hope to continue to be a resource long after this session. So we have a very short amount of time that we have to talk about this. We're going to jump right into it. I don't have any disclosures right now, and these are our objectives for today. So what I want participants to leave this session feeling is that they're able to explain what potassium and phosphorus do in the body, why the levels can rise in CKD and dialysis. I want you to feel confident about identifying potassium and phosphorus additives in foods, and I'll talk about why that's so important. And of course, I want you to leave with at least two strategies, if not more, on how to reduce dietary and phosphorus potassium while still enjoying your cultural foods. Now, talking about cultural inclusivity is something that is very important to me. Um, as a Latina dietitian, it breaks my heart to see a lot of cultural foods get eliminated in kidney nutrition. So today, hopefully I get to talk about ways that we can kind of avoid that while still addressing health issues. So when it comes to nutrition and CKD and dialysis, I always tell my patients what I tell you might be completely different from what I tell another patient with CKD. Because everything is highly individualized. The recommendations you're going to hear from a kidney dietitian are going to be based on your particular needs, your values, your laboratory values, how much residual kidney functions you still have, if you have any other comorbidities that you're working with. We put all of that together for you. So when we're talking about nutrition, CKD, and in dialysis, there are many aspects of nutrition. As you saw in the previous video, they were talking about anemia and gout, and there's so much more that goes into, diabetes, high blood pressure, malnutrition, vitamin deficiencies. But today we're just going to focus on two things, which is potassium and phosphorus. And that is because these come up time and time again as big fears for my patients, and I want y'all to feel empowered about being able to eat while still managing it. So let's start with the big scary one. Potassium is the one that I feel a lot of my patients are afraid of, right? But potassium isn't inherently bad. Potassium is a mineral in the body that supports your nervous system, your muscles, your bones, your ability to regulate your blood sugar, does so many things that are good for us, right? When it becomes an issue is as when kidney disease progresses, the kidney isn't able to filter out the potassium as well. So then you might have issues with hyperkalemia. And then some of my patients who are on dialysis, for example, they might be on a type of dialysis that wastes a lot of potassium, like PD might be very potassium wasting. They might have issues with low potassium. And the potassium in the body has to be very particular because it is in charge of muscle contractions. You don't want it too low and you don't want it too high. If you have it too low, you might have weakness. If you have it too high, then you might have issues with arrhythmias. That's where you start seeing the issues with heart attacks. So of course, those are all, very scary things that we don't want to happen. But the thing that I don't like seeing is that when we have a high potassium lab, the first thing that healthcare professionals want to jump to is cutting out fruits and vegetables, right? It's very common for me to hear, oh, you have a high potassium, you need to stop eating bananas, you need to stop eating tomatoes, you need to stop eating potatoes. But there's actually so many different reasons that a potassium could be elevated or too low. And it's very important that we review those reasons before we even start talking about dietary restrictions. And you might ask, why is that? Like, why would it be bad to just automatically jump to, cutting out these bad foods? Well, that's because there are certain instances we might be actually doing more harm than good by telling a patient over and over, don't eat these fruits and vegetables. So I will go into a couple of those examples. But first off, let's talk about those non-nutrition causes of hyperkalemia. One of them could be a lab error, right? This is why we look at trends. We don't look at just one particular high potassium lab. Two, you have something like acidosis, which is the acid buildup in your body fluids. Now, in kidney nutrition, we have something that's called renal acid load, right? And fruits and vegetables are actually so great for reducing renal acid load because their metabolites are actually alkaline. When you're still early in your CKD journey, you want to reduce that renal acid load to help preserve your kidney function. So again, if you're telling patients to eliminate fruits and vegetables, then you are going to see that they're going to have less sources of alkaline foods, and that's not good for them. So again, let's make sure we're addressing every other reason for the hyperkalemia before we resort to potassium restriction in the diet. Now, you might have issues with high blood sugar. That can also cause hyperkalemia. And that's because the potassium inside the cell comes outside the cell when there's high blood sugars. So this is something that does need to be monitored also by the doctor, but by the dietitian as well. You don't want to jump to, again, restricting fruits and vegetables when really maybe they just need to learn more about carbohydrate control, right? Do they have an endocrinologist that's managing these blood sugars? That can be very important for them to manage the hyperkalemia. Now, for my dialysis patients, you might have issues such as inadequate dialysis. Are they missing treatment? Are you having issues with your fistula, with your catheter? Is there recirculation going on? There's so many different things in the dialysis setting that could be causing these high potassium values. And then you have drug interactions. There are certain blood pressure medications that are potassium sparing. Some of them are potassium wasting. So that means that they can influence what your potassium labs are. And you want to make sure you're reviewing those with your doctor. You're keeping them updated on which ones you're taking, which ones you've stopped taking, or if they got changed in the hospital. All of that medication management is something that your doctors and nurses need to be aware of. And then you have things like tissue destruction. So burns, chemotherapy, alcohol abuse. Again, anytime that tissue or blood cells break down, you're going to have that potassium leak from inside the cell. And that also happens, for example, in GI bleeds when we're talking about GI issues. If a patient has a GI bleed, that could also cause hyperkalemia. And again, talking about GI issues, if you are having constipation, you might have issues with hyperkalemia. This is another instance that I tell my nephrologist, my healthcare professionals, please let's not jump to restricting fruits and vegetables, because if they're having less fruits and vegetables overall, then they're going to have less fiber, and less fiber is going to mean more issues with constipation and more issues with hyperkalemia. So again, it's just a refresher. These are things we want to be aware of before we start talking about dietary restriction. Okay, experts do not recommend potassium restriction unless there is a trend of hyperkalemia. Again, we don't look at one particular lab, we want to look at trends overall. And if you really want to get into it, there are actually no clinical trials that have looked at dietary potassium intake and what that affects the blood serum levels. So what that means is that we don't want you to think that whatever potassium you eat automatically shows up in your blood. The body's a little more complicated than that, right? The way that we break things down, the way the body uses it, it's all very complicated. So it's not linear in that way. And that's especially what new research is showing, is that the dietary potassium you eat isn't necessarily going to be reflected in your blood levels. It might be other issues like we were talking about with the diabetes or high blood sugars that might be influencing it. So I know that can be very confusing, and you still feel like you want to do something to help your potassium, right? You still want to kind of take charge. So in clinical practice, our rule of thumb for potassium restriction is about 2,000 milligrams a day. What might help you remember that, it's very similar to the sodium restriction that a lot of kidney patients are on, which is 2,000 milligrams a day, or the amount of calories that the average American can eat, which is 2,000 calories a day. It's all 2,000, 2,000, 2,000. All right. So let's get into some strategies as far as the diet. Again, we've already reviewed everything else. We eliminated all of the reasons for this potassium. Now we can talk about the diet. So not all potassium is created the same. There is organic potassium and inorganic potassium. All that means is that certain foods already naturally have potassium inside them. We're talking like beans or a lot of fruits and vegetables. When they came out of the ground, they already had potassium in them. That's organic potassium. Inorganic potassium are those potassium additives that food companies use to keep foods fresh longer, right? They help increase shelf life and have many other uses. But that type of potassium, your body absorbs it almost 100%. So it's really important to try to find if the foods that we're eating, especially canned foods, frozen foods, packaged foods, if they have these potassium additives. Those are the ones you're going to want to stay away from the most. And what makes everything a little bit extra complicated is that now, because companies are starting to want to be a little bit health conscious, they're creating these like low sodium versions of their food, but the way that they're reducing the sodium chloride in their food, which is the sodium, right? The salt, they're reducing sodium chloride by using potassium chloride. So if you see a food that says it's low sodium, just be extra careful that they didn't take out the salt by putting in potassium chloride. So you would be able to find these potassium additives on the nutrition label, not on the top part, not in the top box, but underneath where the ingredients are. That's where you might see something like potassium chloride. And speaking of label reading, one thing that I like for patients and everyone really to be aware of is that although a lot of food companies are putting potassium on the label because it is required, some food companies are not actually testing the food. So what that means is that that number will automatically default to 0. So that's how you get maybe like a bag of beans or something that says 0 milligrams potassium. It's because they might have not tested for it. Or if per portion, that amount of potassium in that food is less than 2% of the daily value, which is 4,700 milligrams, um, it's considered negligible. So again, those food companies can put 0, and that's how you can find, jars of salsa that'll say, oh, 0 milligrams potassium because their portion size is 2 tablespoons. And in those 2 tablespoons, there's less than that 2% for your daily value, if that makes any sense. But that's something to consider because I can't remember the last time that I had, 2 tablespoons of salsa. So something to keep in mind when looking at the potassium on labels. Um, then we come to like as far as how you're cooking your food, that also affects the amount of potassium in it. If you have things like beans, potatoes, leafy greens, something that you do need to cook or heat up before consuming, I always recommend the double boiling cooking method. So there's two different ways that you can do that to leach out potassium from your potatoes and beans and whatever you're using. You can either soak it overnight, then in the morning, throw out the water, put in new water, heat it up and cook it. That's one way. Or two, you can put your food in the water, have it come to a boiling, turn it off, let it cool, pour out the water, put in new water, and then cook it again. Either of these methods helps to significantly reduce the potassium in foods if you're looking to do it that way. I do recommend you do big batches at a time since it can be time consuming, and then saving it maybe in molds in the freezer or something to make it last longer. And then, of course, we have portion control. Now, whenever my patients are learning about managing their potassium, they'll talk to me about the lists that they got from the hospital or the list that they got from the nephrologist. They have a list of foods that are high in potassium and a list of foods that are low in potassium. The problem with that is that you need to keep in mind that it doesn't matter which food from which list you're using, it matters how much you're using, because it doesn't matter if you're having, something that's low potassium like grapes, but you're eating, 3 servings of it, and it's no longer going to be low potassium. And on the other side, you can take something that's considered high potassium, like a tomato. An entire Roma tomato only has like 240 milligrams of potassium. So you could use an entire Roma tomato as a part of your meal, and it would still be considered low potassium. It just depends how much you're using, right? It's not the same having a little bit of pico de gallo on your food as it is having a cup of salsa or a cup of tomato sauce. So it definitely matters how much you're having and how concentrated the food is that you're having. Is it a juice? Is it a sauce? Or is it a piece of the whole food? All of that is going to matter more than what list it's on. All right, and we're running out of time, so I'll quickly go into phosphorus. Phosphorus is a mineral that's essential for energy production, storage, cell membrane structures, and bone health. This one is one that we have to be extra careful with because research does show that dietary phosphorus is associated with calcium buildup in the arteries, cardiovascular disease, and mineral bone disorder. So MBD, basically, when you have a high phosphorus, that takes the calcium out of your bones, it puts it in your skin and your blood vessels, and then over time, that's going to lead to that calcification. It's going to lead to things dying, like skin dying, organs dying. So we do want to keep your calcium inside your bones, and to do that, we want to keep phosphorus at a healthy level, right? Similar to potassium, we do want to make sure that we address all those other reasons for high phosphorus. There are some medications like reflux medications, flu medications that are high in phosphorus to be aware of. And of course, making sure you're getting adequate dialysis if you are a dialysis patient. All right, and then strategies for eliminating dietary phosphorus. For this one, we do have a little bit more information on specifics as far as that organic versus inorganic phosphorus. Very similar to what we talked about in potassium. One is natural, one is to help preserve food freshness. If your phosphorus is coming from plants, you're going to only absorb about 20 to 50%. If it's coming from animals, 40 to 60. And if it's coming from additives, 100%. So we talked about how to find those additives on the food label. That is the best thing that you can do to get like more bang for your buck as far as restriction is to avoid those phosphorus additives. Try to stick more to like the plant-based if possible because you don't really absorb that well. My biggest recommendation for my patients, if possible, like if you have kitchen appliances, right? If you have that type of security, try to do more home cooking versus restaurant. You can have a burger at home and it'll have half the phosphorus that you're going to find in a burger at a restaurant. Because again, restaurants are using a lot of foods that have those extra additives. So whenever you can use fresh ground meat or fresh anything, whenever you can make something from scratch, even just being aware of like different food companies will use different types of preservatives. So just as an example, for my Hispanic patients, they want to have corn tortillas sometimes, and I'll let them know, well, La Banderita is a brand that doesn't use phosphorus additives. So make sure you're being familiar with different brands to try to eliminate the most phosphorus from those additives. After that, of course, work with a kidney dietitian. They might be able to help you with that, but that label reading is really going to be helpful. Um, After that, it's going to be portion control. So again, when we talked about, for example, I still want you to enjoy your beans. They still have all these great properties, fiber, everything. But you want to be mindful of your portion. Something that's like low phosphorus portion would be like half a cup. So whenever I say like you can have your cultural foods, it doesn't mean you can have, as much as maybe we used to. We do have to be mindful of the portion, but that doesn't mean that you can't have it at all. And then, of course, a big one that I talk about with my patients, especially my dialysis patients, if they want to keep their phosphorus in control, they're probably going to need help from medications. So this would mean binders, right? And then even blockers that are coming onto the market now. So making sure you're taking your binders, that's something that attaches to the phosphorus when you eat. So you take it right after that first bite, if possible. And then the blockers are usually either once or twice a day. Being compliant with that medication can really significantly reduce the phosphorus in your overall diet. So, um, just as a summary, as a recap, if you really want to get the most bang for your buck, look for those additives, both in phosphorus and in potassium. And then after that, it's going to be portion control. And of course, work with your nephrologist, your kidney dietitian to help figure out the right portions for you for your particular labs. And these are my references if you have any questions. And that's it for
Great.
me.
Thank you so much, Aurelie, for this engaging presentation. And thank you to all of our listeners for joining us today. And I'd also like to thank our sponsor, Ardelyx, for making today's session possible. Next up is our Q&A with renal dietitians. It's going to begin at 1 p.m. Eastern Time. And during this session, we will have two renal dietitians who will explore the important role of a dietitian in managing kidney disease and answer all of your questions about nutrition. Please join us for that session, 1 p.m. Eastern Time today. As we wrap up this session, we will see a brief survey pop up. So please take a minute to fill it out and tell us how we did. Your feedback is super helpful as we plan future sessions. Thank you, everyone, and hope to see you on the next Q&A session.